Hey guys, we're going to be dressing up together. Trust me, you don't see my body right now. I just wanted to start off by showing you guys the body cream that was recommended by my GP. So this is the one that I've been using since the early part of my second trimester, where I said my body or my skin had been itching me, felt very dry and flaky, especially around my back area. And I think it's kind of picked up a little bit now, again, with the intensity of the itch that I've been feeling. But with this cream, I haven't exactly reacted to this pregnancy as much as I did in the early days of my second trimester. So yeah, I'm about to finish this jar, and when I'm done with this one, I will most likely call him again to recommend another one for me so that I don't get to die before the end of my third trimester, because the earliest stage I was using shea butter, which is sworn by most people. I was mixing it up with this Burt's Bee, what exactly is this? Rosehip oil, and my god, my skin wanted to fall off. I was scratching like a mad woman. I couldn't hold myself from itching. Every day it was a struggle, but goodness gracious, can anybody appreciate how fat and chubby my face is getting right now? I'm really looking pregnant at this point. Hello. So I have moved from here to here, medium, and now we are somewhere here. Whew. Who knows, we might just get to the extra large soon enough. My back is beginning to hurt like crazy, which is not getting easier coming to work anyways, but yeah, I'll just take this off now because I don't want to be identified with my badge while working. I'll just be talking to you guys at this point. But yeah, somebody has helped me to switch on the machine, so I'm just going to put in the password this morning. Thankfully, we haven't had any patients yet, but this is where I am going to be working, well, most of today. I'll be working between the x-ray and the mammo unit. Anyways, some bad news here in my office. We have some of our staff that have been affected by the COVID virus, so they've had to isolate, and yeah, there's just a few of us now that are still negative, that are turning up to the office. One of them is myself, who is very pregnant, so I'm trying to be as safe as possible. I'm the only one who has come into this room right now, so that's why I'm not using a face mask, because I need to breathe. I'm breathing for 2 people at this point, guys, so please bear with me. For those who are yeah, wear your mask champions, it's really important. And yeah, I've been trying to be as safe as possible. I think for the last 2 days I haven't had any symptoms. I just had a headache and my throat has been tingly for a bit, but I think the tingly throat is because I sleep with my windows open. So usually when I wake up in the morning, I kind of have a little bit of cough, but I don't think it is anything close to COVID-19. So right now I'm just staying positive, because we did a swab test yesterday. We were all tested in the department, and we're just waiting for the results to be sent to us at this point. So I'm in the mammo unit, guys, and this is the machine that I get to work with. It's a Fuji unit. It's a Fuji unit. I really love this one. I think in all of the years that I have done mammos, which is 3-4 years now, this is the very best that I've worked with. One thing is because it doesn't take time to switch on, and it's very easy to work with. I think this is anybody can work with this unit. It doesn't take time. So we're going to be spending most of our day here. Now that I'm pregnant, of course, I've had to adjust to some changes. One of which is I don't get to work in theater. My manager literally just once I came into the office, she was like, because of the weight of the lead aprons, I won't let you go to theater, which was very relieving for me, because I was quite worried with having the weight of the child and having to also wear the lead aprons, which I know that for some radiographers, if it depends on where you're working at, you get to work with a lead apron. Please just give me a moment. Let me just set up this space. here, and then we can get just So I'm just getting the room ready to do my calibration for the morning on the machine. So yeah, so what was I saying? Yeah, so I don't get to go to theater right now because I'm pregnant. So that's that's just one way that I get to protect myself from radiation. One other thing, of course, which I get to do is I'm very conscious now of standing behind the LED screens. So I'm really cautious now whenever I am exposing my patient to, like, I don't just accidentally like stand on the corner or like try to help someone. I'm always behind the LED screens. And then I also have a LED badge with my name to it. Yeah, so this gets tested every month, and so far so good. I haven't been overexposed to radiation, so baby's safe and I'm also safe at this point. So I'm just going to be entering the details of, oh my goodness, speaking these days is so difficult, but I'm trying so hard to keep working because I think I would rather be at work than be at home right now with this pregnancy, because I just feel like if I'm home I'll probably just be a very lazy pregnant woman. I don't know, I just feel like that's what I will be. I'm not talking about like women in general, I'm just saying that's what will happen to me. Moment of truth. 70, 68. My weight hasn't changed in the last 6 weeks. I don't know if I should be excited or if this is not normal, but it's just something that I've noticed. Okay, so I just finished up with that last patient that I had, and she was quite a difficult one to do, but it was because she had implants. So for the patients who have implants who come in here, we give them a consent form, which is not something that I was used to with my last, the hospital that I worked in the last time. But here they give them consent forms, and the thing about implants is it can, I mean, anything can hide behind an implant, so you just have to let them know that there is a possibility that we might miss an abnormality in the breast, which is not too often, but it's a possibility, so that they are just aware in case that gets to happen. But anyways, this is the position, or this is the area where my patient gets to change. So usually when they come into the room through that door, I lead them down to this area, and then they come down here and they have to take off their clothes or their tops and their bras and place on this chair. And then we have this poster here that just gets to inform any lady who might be pregnant to let the radiographer know. So yeah, I'm in that position now, so I have to also be careful of myself when I am in this area working. We also have this poster here that just helps our patients understand breast cancer and how exactly they can get to, you know, just the importance of constantly checking your breast. Toilet time. For sure, my bladder controls my life now. It has a mind of its own and makes me go like 500 times a day while I'm in the office. I'm just glad that we have a very clean toilet that I can use, because that was something that was so important to me. going through this pregnancy and being in a workplace where we have a toilet that I will walk into, and I'll be very glad using it, even if it's 500 times a day. But anyways, this is me right now. Most of my patients, especially the elderly ladies, I think they're the ones who, whenever they see me like wobbling like a penguin to my office, they're like, how far gone are you? You look like you're having twins. Are you sure it's just 5 months? Because you look like you're having twins for this pregnancy. But I guess it's just because I've always been very skinny and my body's just trying to, you know, pull as much as it can, all in the name of stretching. But I feel good, and I'm enjoying this pregnancy. I have to tell you guys, at least most of it, not every day. I didn't sleep well last night because I had leg cramps. That's the worst part of my second trimester. I keep saying it. It's just unbelievably painful. You're lying down and just from nowhere, my thighs start to cramp when I'm deep in sleep. And last night Chris was on call, so there was nobody to even keep me company while I was in pain, screaming in my bedroom, and I just couldn't sleep for a very long time. But at least I made it to the office today, so that's a good thing. So because of the outbreak in my department, we've been asked to eat in a separate room from the restaurant. So this is a conference room. I've actually just finished my lunch, and I have this brownie that I bought from the canteen. As you can see, I did not pity my bones today, but I'm just trying to take a break to breathe, because right now I feel like a heavy elephant that cannot walk. So I have like 5 minutes to rest before I go downstairs and continue for the day. Alright guys, so I'm in the utility room, the dirty room. So this is like where we come to change now, because we've been isolated from the rest of the hospital, like I said. So basically my manager just called me like 2 minutes ago. I had a very quick chat with her, and she was like, oh, your PCR test came out this afternoon and you're positive, you're COVID positive. This is the first time I'm ever hearing those words, guys, and I don't know how to feel, because I haven't been pregnant in all of the times when I've been hearing about COVID. So it's really shocking for me right now, and I'm trying not to be scared. But then again, even though I feel okay, I don't have any symptoms right now except for the bland taste in my mouth, which I was telling my sisters about last night, and then my throat's being very ticklish. I don't have any other symptoms, so I'm just hoping that all I need to do is just go back home now. I'll send Chris a message so that he knows ahead of time, and then I'll call my GP, call my midwife. I'm supposed to have my second appointment since this pregnancy started. You know, I feel so bad because now I have to cancel that appointment. I haven't seen my midwife since the 12th week of this pregnancy, and I was really hoping that I'll be able to go there and ask her all the questions that I have written down in the last 12 weeks since the last time I seen her. So it's not exactly the most pleasing feeling to be going through right now. I'm trying not to cry. I mean, I didn't even know how exactly to express myself when my manager said you're COVID positive. I'm like, a lot of thoughts going on through my head. But I guess my immune system is low because I've tried as much as possible to be as safe as I could, and I was supposed to be, you know, not seeing a lot of patients, which I have been practicing, you know, washing my hands, wearing the face mask and doing everything that we're supposed to do. I just hope it's not a very vicious or violent variant that is that has affected me. So yeah, at this point I really don't even know how exactly I'm supposed to be feeling, but I don't feel so good. Yeah, I'm just going to have to dress up here, change into my home clothes, and then from here I'll be heading back home in a few minutes time. So yeah, I just thought I should I don't even know, am I closing up this vlog at this point? Maybe I will, maybe I won't, but that's exactly what is happening right now. And it's not the easiest of things to digest. It's not the easiest of news to digest, because it's really difficult. I mean, I feel okay, I feel well, but for the baby, I don't know what this means. So let me go home.